I'm just like everybody else, Medicine's tough. It's getting tougher, but we've got some technology that's gonna hopefully smooth the seas for us. And one thing that I can tell you that's a lot of fun, at least for me, is the fact that I go so far back that I remember the days when we go to a meeting, and we go to a meeting like this, and I'd lean over to Bert Chandler, who was also a Floridian, or anybody else, and we'd go, what do you do? I don't know, what do you do? Does that work? I mean, this is before RFA, this is before a lot of the technology had come to mature. I had learned cryo. Cryo's made a resurgence. Thank you, Andrea. And we'll talk a little bit about that today. But I'm going to try to stick to peripheral stim. And I'll go off the reservation a little bit because I want you to see how valuable this is for your practice. And I mean, it really is. When I did peripheral stim in the early going, we had to use IPGs, those big generators. And there's inherent problems with those generators. Thank you. I got one of these. Does that work?
This one works better.
Oh. Yes, it does. I want to point out that Dr. Trescott helped me with these slides from her corporation. And she's been invaluable. So is Dr. Weiner. She's running pain school through FIP, and thank you to Stimway. But the story of the peripheral stimulation is from a cool technology with an IPG, and it fell out of favor because it just was clumsy and cumbersome. It required surgery. It was just a big deal. To the reimbursement problems, and now the pendulum swinging back. All right, I did this at the annual meeting. I think it's kind of cool that if we start meetings or if we start individual talks, like a TED Talk, everybody has a story to tell. And I think some of our faculty has some fascinating stories. And so I can't call it TED Sip, I think that's a problem. I call it Med Sip. And I picked an individual who had to overcome challenges just like we did. And I know this individual doesn't mind me talking about him, Michael Waite, because he did a TED Talk. And it's a fascinating TED Talk if you want to go to YouTube. He's a CEO. He went up and down and up and down. He lived with his parents. He stole. He got in legal problems. And he had to change his life or he was going to die. So he started to figure out that it's time for change. Now, for those that don't know, I also do addiction, and we call it, Are You Ready for Change? And if you're ready for change, you move on. You get help. He took a company as CEO, made it one of the best places to work in Seattle year after year, 200 employees, no VC. He used a credit card. Don't do that, he says. But he turned this corporation into an Inc. 500 corporation in a matter of years. And I propose to you, we have a lot in common with them. Pain physicians, a lot in common with them. Great leaders do what drug addicts do. Michael Waite is a drug addict. He almost died from drugs, and he said, I'm ready for change. What did he do? Well, ASIP, Florida SIP, and the other organizations that I've spoke with do the same thing. This is a mantra for addiction. Practice rigorous authenticity. That's what we do. Surrender to outcome. That's what we do. We surrender the outcome. We manage the outcome. And we do uncomfortable work. Very uncomfortable work. And this is the mantra, day in and day out for an addict. Now, we have the option of doing it. They don't. All right, you got to know your why you're here, why you keep practicing. All right, these are my fails when I was president. I just couldn't get it done. A couple of things happened, life happens. Mastermind groups, I think it's a fantastic idea that we get together in small mastermind groups and create productivity. And if you don't know what a mastermind group is, go on to YouTube and check out Pat Flynn, or I'll give you some places to go. Mastermind groups allows us to practice authenticity and to do tough things and win. Slack. Slack is an email, closed email that's, you can't hack it. And I think it's really good to get involved in Slack because it keeps everything confidential, keeps it reined in. What we won with, and we're doing it, is to preserve intellectual property. It is terrible that these absolute geniuses you've seen up here, present company, they have given us incalculable material that we should preserve. Now, if I could tell FSIP to take it one step further, let's figure out how to put it on Bluetooth for our car when we're sitting in traffic and CME it. So we're going to work. Now, it's not going to take away from your meetings. I think it will enhance the meetings. We want young people that are mobile to get involved. All right, that's protecting intellectual property. Expand the podcast, we're doing that. I probably have 40 podcasts that I've got to get up, and many of your members. Sandy and I are going to do one in just a minute. If you want to learn how to podcast, I'll show you. And it's very inexpensive, and it's a voice. Maybe FSIP ought to have a podcast. And courses. We should be developing courses. All right, I'm going to get moving here and really pick it up. Resilience is this. That's what we have to be. We're going to get knocked down, but we got to get back up, okay? We can't be the product of our own destruction. That's why we have donated to the PAC and the things we do. I can tell you that Florida supports ACIP, and they do a fantastic job and help us become resilient, and we hope we can do the same. The victim is the most powerful person in the room. That would be the tough, difficult patient. And they look like this. They're unhappy. They have a personality that operates on emotion, not logic. Everybody in this room is logic. This is emotion. What we do is handle that kind of patient. Don't practice in fear. If you practice in fear, you make mistakes. Either overtreat or undertreat. Listen to the little voice on your shoulder. So, is stimulation for real? This peripheral stimulation. By cracky, it is. This is from a couple months ago in British Medical Journal. It basically talks about the resurgence of peripheral nerve stimulators because of these new devices. And these new devices are stunningly elegant. They're going to give you a whole new broad brushstroke to treat pain, and I hope it does. They're this big. That's a little different than an IPG, isn't it? Look at that technology. It's incredible. The wires are very flexible, and so instead of those stiff leads we had to put in with the IPG and the previous dorsal column systems, we've got flexible leads. And look how they're going. They're getting smaller and smaller. I actually started putting stimulators way on the left, and it was like you're putting a brick under somebody's skin. They're really heavy, too. That may be a pump, but maybe a stimulator, but one of the most common reasons for explant is pain. That's the number 2 reason, is pain. This is StimWave's equipment over here to the right, another elegant piece of equipment. And this is what they look like inside. Look at that circuit board down there. My gosh, that's pretty neat. But that's going to replace your RPG. And so no more big boxes, just this incredible technology. It's also Bluetooth programmable, you know, these things. All right, the new technology is this, all right, low exit rate for now. The old tech is that. There's a lot of explants with the old tech. Peripheral nerve stimulation is probably one of the hardest. These are some of the bigger companies here. I don't have any affiliation with any of them, except great friends with Andrea, medical director of StimWave. I guess that is an affiliation for life. And Tim Deere looked at this. This is industry sponsored, by the way, not StimWave's, it's another company. But they looked at it. Are these things doing anything? Well, Tim had a pretty good crossover double-blind study where, okay, look, so there was quite a few patients, enough. when you had that peripheral stim turned on, you had statistically relevant relief. Well, you cross it over. Does the other group get it? When you cross it over, it appears so. So this is probably real, and it's probably not a placebo. It's probably real. These are the contraindications, the usual players. Psych would be the biggest one. So psych is psych. Just like you put in an RPG, if you're going to do peripheral stimulation, psych, psych, psych. You got to make sure you don't have an issue there. The history is cool because I'm telling you, I'm guilty of it too. What we do with pain doctors, because we're so busy, just like many others, is sometimes we don't put our hands on a patient. We look at an EMR or we look at them and, if they don't have drool coming out of their mouth or something,